mindfulness, I mean, it's so important. And yeah, I think it can't be stressed enough. And speaking of stress, I'm excited to introduce our next presenter. He is a rheumatologist in private practice at the Arthritis and Pain Associates of Prince George's County in Greenbelt, Maryland, and he's an associate professor of clinical medicine at the Uniformed Services University in Bethesda. And he's a chair emeritus of the Medical Scientific Advisory Board of the local DC, Maryland, Virginia lupus chapter. He's passionate about teaching others about lupus. He is the author and has gotten the seal of approval from the foundation for the Lupus Encyclopedia, a comprehensive guide for patients and families from the Johns Hopkins University Press. And he runs a lupus educational blog and Facebook page called the Lupus Encyclopedia with over 29,000 followers worldwide. He has personally seen how his lupus patients often flare up during periods of stress, and he's looking forward to telling us how stress interacts with the immune system and what patients can do to deal with and decrease their stress. I think we can all use that. So I will turn it over to Dr. Donald Thomas. Dr. Thomas? Dr. Thomas?
Oh, hey, Zach. Oh, I didn't realize it was time. Well, hey, everybody. Sorry, I was just doing the treadmill. And I want to give a shout out to Joyce Phillips. I see she's doing her treadmill as well, so good job. But, you know, during COVID-19, we've all been stuck in our houses. I've been sitting at my desk a lot. And so I actually got a treadmill desk. I do this between my patients, and I actually do this at home when I'm seeing them virtually, but also in my office as well. And we'll talk about exercise in just a little bit. So let me just here first share my screen. And let's see, screen. And let's see, it says that I cannot share the screen. Can you help me out there, Zach?
Let's see. I'm wondering, Cindy.
Oh, make me the host, I guess.
There we go.
Very good.
Try now.
All right. And how's that?
Perfect. Can see your screen great. Your slide.
All right. Very good. So, by a show of hands, and you can show your hands either by waving like this, or if you look down at the bottom, you'll see a little reactions button. If you see or you hear something that identifies with you, just wave like this or hit one of those reaction buttons. By a show of hands, how many of you have noticed that when you're under stress, that oftentimes your lupus flares? How many people have noticed that? I want you to see all the hands that are waving and all the reactions with that. Now, I'd like you to think back to when you were first diagnosed with lupus. The year or two before that diagnosis, were any of you under a lot of extra stress? If you were, raise your hands and wave them or do the reaction button. Again, look at all the people who are waving right now. This is no coincidence. There is scientific evidence that stress causes abnormalities of the immune system and can make lupus worse, and it can increase the risk of getting lupus itself. During the next 40 minutes, I'm going to show you research that shows the effects of stress on lupus and the immune system. But more importantly, I want to show you several very easy habits that each and every one of you can use yourself to help decrease the unhealthy effects of stress. And so let's get started. So this is a picture of the bull run in Pamplona, Spain. They hold this every single year. Now these guys right here in front of the bulls that are running away from them, don't you think that they're under a lot of stress right now? They're having a lot of anxiety. They're having a lot of stress. The first thing I want to point out is that stress and the anxiety that it causes is normal. It's an important fact of life. It's actually one thing that helps keep us alive, and it helps us stay away from those things that are dangerous in our life. And so those of you who are watching this and have problems with anxiety, please don't feel guilty about having that, because that's something that we absolutely have to survive. When people are under stress, a part of the immune system, or part of the neurological system called the sympathetic nervous system, becomes active, and it causes things such as fast heart rate. The pupils of the eyes get large so that we can see more. We get very jittery and shaky when that happens. It's basically our fight or flight. And these guys they're running away, or they're in the flight mode, but they could also be in the fighting mode as well as doing this. But once the stress is gone, their sympathetic nervous system goes back down to normal, and they can relax and just go back to their normal daily life. But unfortunately, some people, their brains are trained and their neurological system is trained that this anxiety and stress part of the neurological system doesn't calm down. It stays active a lot, or unstressful things that happen in their lives will cause these same reactions with high heart rate, jitteriness, feeling very anxious. And it's because the body secretes certain hormones like cortisol and adrenaline that have these things happen. And the problem is that people who have chronic stress and recurrent anxiety, having all this extra cortisol and adrenaline causes bad health effects, such as even early heart attacks, but it can also cause abnormalities of the immune system. So what does it do to the immune system? First, let's look at just one little tiny part of the immune system. If I drew your blood and looked at it under the microscope, this is one thing that I may see. All those little red guys that you see, those are the red blood cells. They carry oxygen throughout our body. But look at those blue guys. Those are called lymphocytes. They're B cells and they're T cells. The B cells, I like to call them the bad B cells in lupus, because these are the ones that make those autoantibodies like anti-nuclear antibody, anti-DNA antibody. But one thing that happens in lupus is that most of our lupus patients, their lymphocyte count is lower than normal. They don't have enough of the lymphocytes that are protective and that are the good lymphocytes. They have too many of the bad lymphocytes. And then when they flare up, the lymphocyte count often goes down. The lymphocyte count being low is so important that it's actually one of the classification criteria that helps us diagnose lupus. Many of you watching this, you have a low lymphocyte count that helped your doctor diagnose you. I see some of my patients here, by the way, and thank you for being here. Some of you were diagnosed because of your low lymphocyte count, and I have it in your records. It's such an important thing. One person who is specialized in looking at how stress affects the immune system is Dr. Janice Key Coltglazer. She's at Ohio State University. Go Buckeyes. I'm from Ohio originally. Anybody else from Ohio? A couple of people. Good. Go Buckeyes. Well, anyway, she specializes in how stress affects the immune system. And it started way back in the 1980s. Back then, this is what a typical medical school classroom looks like. It's huge, lots of students there. And she is part of the medical school at Ohio State. So she decided to do an experiment on the medical students because they do get stressed. And she wanted to know what happens to their immune system. Well, of course, one of the most stressful times in medical school is the week of exams. Exam week is horrible. I've had many all-nighters and no sleep during exam week. It can be pretty bad. So she looked at something called natural killer cells. It's another type of white blood cell that's related to the lymphocytes. And she decided to study them and see what they do during times of stress. What she showed is that low levels or decreased numbers of natural killer cells occurred in certain people. She tested the natural killer cells before exam week when people should not be stressed whatsoever, and then during exam week. And what she showed is that the people who had the lowest levels were those students who were initially stressed even before exam week started. Also, those students who were very lonely, who were isolated, and that's a very stressful event, they also had the lowest levels of natural killer cells. But then during exam week, It was across the board. People who were usually not stressed and became stressed during exam week had very low levels of natural killer cells. And guess what happens in lupus? During lupus flares, the natural killer cells also decrease. So we can see just by simply from this experiment that stress does cause abnormalities of the immune system, and it's abnormalities that we typically see in our lupus patients. Since the 1980s, there's been tons of other studies since then, many of them by this particular doctor, but also others. So it does cause immune system abnormalities. It's not in your mind. So how about lupus patients themselves? What happens with stress and lupus itself? I like to go to one study that was done in 2008. If anybody's ever heard of this, it's called I like to talk about a study called the Nurses' Health Study. This was a study that was started back in the 1970s, and they looked at over 100,000 nurses, and they followed them over decades to see how their health would do and to see what kind of things would influence their health. These are things where we learn things such as high cholesterol causes heart attacks, or certain lifestyle changes or family histories increase breast cancer. A lot of that comes from these particular studies. So they looked at the second part of the Nurses' Health Study, and they recruited 55,000 of these nurses, and this was done at Harvard, and they asked the question, does major stress increase the risk of lupus? And so they gave out a questionnaire to 55,000 of these nurses. And the reason they use nurses, by the way, is that nurses, of course, know health incredibly well, and they're going to be very accurate with their answers regarding these health questions. So they asked them about major trauma, and then they asked which ones were officially diagnosed with systemic lupus. They asked them which ones have been in major accidents in the past, for example, which ones had experienced significant natural disasters, which ones had suffered post-traumatic stress disorder, not just from war in the military nurses, but also this can happen from just horrible things that happen to us, such as violence against us can cause PTSD. But they also looked at child abuse, which is horrible, and of course sexual abuse. And they put all this data together. And guess what they showed? Those nurses who suffered some sort of major stressful event during their lifetime were 3 times more likely to develop systemic lupus erythematosus. And just this past month in our journal called Lupus, another article just came out that showed a very similar thing with major childhood trauma and sexual abuse increasing the risk of lupus. So major stress even increases the chances of developing systemic lupus in the first place. Now, how about lupus flares? When I diagnose someone with systemic lupus, that's a horrible day in that person's life. I've had one patient who told me that after I gave her the diagnosis, and I remember this vividly, when I diagnosed her and I educated her about lupus and everything, she's a sweet lady. She's one of my favorite patients, but she smiled, she took it all in. She said she would do everything I taught her. We did her laboratory work. But then about 10 years later, she confessed to me that when she got out into the parking lot, she sat there and she cried for 15 minutes. She was just so torn up that she couldn't even drive. And I'm sure that many of you had similar reactions when you were diagnosed. And that's the kind of thing that I usually don't see. Patients usually hide that from me. But from the very first part of that diagnosis, you're immediately met with a lot of stress. This shows how flares of lupus happen over time. At the very first of your diagnosis, which is the left side of this graph, the higher it is, that represents a flare. The low part represents when there's not a flare. You have usually a very significant flare, then it gets better with treatment, but then over time it waxes and wanes, and you have times of increased flares and decreased flares. And a lot of times these are associated with stress, like many of you have noticed. This past year has been horrible for all of us. Many of us who are healthy and don't usually have stress have even been under a lot of stress. This is a picture of a nursing home. And just think about it, 80-year-old and 90-year-old people who sometimes the biggest thing that they look forward to every day is being able to hug their grandchildren or their son or their daughter. And for the for a whole year or so, they just had to look at him through a window. All the visitors could just go up to the window and wave to them and say hi to them, and they had to step back from the window as they did it. One of my best friends, who works for the Lupus Foundation, he told me that his father, unfortunately, actually died from COVID-19 at the very, very beginning of the pandemic, and we didn't know what to do back then. They were so scared of this infection that what happened to him and his family is that they took his grandfather's his father's coffin, and they used a machinery like a backhoe or something to actually lower it into the casket. The priest was standing at the side of the grave of the burial plot, but the family, they had to stand outside of the fence. They were not allowed even inside the fence of the cemetery to see their own father buried and listen to the priest. And afterwards, the priest came up to them and told them that he didn't know how they didn't just jump over the fence, because it was just a horrible situation. But these are the kind of things we've all dealt with, incredibly stressful events. So the next question, though, is since we know that stress can make lupus worse, it can cause lupus in the first place. If we teach lupus patients to be able to deal with stress and decrease stress, does that make a difference in their lupus? Because that's the really important thing. We know that stress can increase lupus problems, but if we teach you to decrease stress, does it truly make a difference or not? And so they did a study at the University of Pittsburgh Medical Center at the Lupus Center of Excellence. And Dr. Susan Manzi, who's one of the world's best lupologists, and she's very active with the Lupus Foundation, as all the staff here know. But she got together with the Center for Complementary Medicine, and they asked the question, if we teach our lupus patients to decrease stress and learn how to decrease the effects of it, what happens to their lupus? So they took 92 systemic lupus patients, and then they taught them how to reduce stress. And they just did it in 6 sessions. They taught them how to do breathing exercises or mindfulness, like Cindy mentioned at the beginning of the talk during her portion of it. They taught them just simply how to do breathing exercises, muscle relaxation techniques, and then they gave them homework and they gave them practice sessions. And then what they did is they reevaluated these patients at the end of the study, and they looked at what happened with their lupus when they did these particular things and what happened to their symptoms. What they showed is that and they compared them, by the way, that some of the patients did not get any of this and some of the patients were taught the stress reduction. The patients who were taught stress reduction, things like doing mindfulness or breathing exercises every day, they had reduced pain. And just think about it. How many of you have pain from your lupus? Can you wave your hands? I mean, that's one of the most common things that we see, and it's one of the hardest things to treat, by the way. I'm really good at treating severe lupus nephritis, where it attacks the kidneys, where it attacks the lungs, where it attacks the skin and such. But I have a very difficult time getting rid of the pain in a lot of my patients. But here's something that did. Also, it showed that it improved general well-being in those patients, and that their physical function improved. These are things that are very hard for me as a physician to help out with my patients. But these patients who learned how to decrease stress were able to get them under better control. And this is not the only study to show this, by the way. There are other ones as well. But this practice of mindfulness or breathing exercises is such an important thing. At our most recent American College of Rheumatology meeting, by the way, they even showed some research that showed that people who practice mindfulness with autoimmune diseases, that it actually improves the immune system itself. So not only do they feel better, but the immune system itself is getting better. I do practice mindfulness. I try to do it every day. I just do 5 to 10 minutes. It doesn't take very long. They'll tell you when you're taught how to do this, you can sit in a chair, have an upright posture, and relax. I like to do mind breathing down, like you see here in the picture. I just find that a lot easier when I do it. Like Cindy mentioned, it's a practice of being in the present and being non-judgmental. And I'll explain what that means. And by the way, I know that this might sound kind of new agey to some people and kind of out there. And if you would have told me this 15, 20 years ago, I would have thought the same thing, but the research is just too strong right now. But I like you to think about it this way. And all of us had this happen to us. Just think about, let's say that yesterday, one of your favorite family members, you snapped at them and you said something mean that you didn't really mean to say. And then for the next day or two, you just run this through your mind over and over again, thinking, oh my goodness, I wish I would have handled that differently. Why didn't I say it this way? Or why didn't I say it that way? And you try to go to bed, and then this is all running through your mind. How many people have had that kind of thing happen in their minds? Another scenario, let's say you have a big dinner party tomorrow. You're going to have 5 family members over. There's 100 things to do. Most people would just write down, their list of things to do, and that's it. But people with anxiety and don't know how to deal with it well, they'll run through their mind over and over again. Oh my God, how am I going to get all that done? They go to bed, they can't sleep. These are things where you're not being in the present moment. You're being judgmental to yourself. Your mind is racing. And what happens during these periods is that cortisol is increased, adrenaline is increased, and it's actually bad for our bodies and it's bad for our brains. But people who practice mindfulness, they have much better health effects. And I'd like to show you just a couple of interesting studies. This shows an MRI of the brain, and this comes from one study I like, where they took 50 people who were meditators. These were people who meditated for at least 20 years or more, and then they compared them to 50 controls, 50 people who don't do any breathing or breathing exercises or meditation whatsoever. And then what they did is they measured different parts of the brain. And what they showed is that you see this area over here, this blue area that's circled with some pink. That's an area of the brain called the hippocampus. The hippocampus is a very important part of the brain. We call it the library of the brain. It's important for memory. It's important for conflict processing. And people who did the mindfulness and the meditation had significantly larger hippocampuses than people who didn't. Just think about that. Just simply doing breathing exercises had a part of the brain that was bigger. And by the way, diseases or situations where we see small hippocampuses, that occurs with the aging process, it occurs with dementia, and guess what else? It happens in people with chronic stress. And so this is just something that's so simple to learn. And just think about how many of you have trouble with memory and lupus fog, as we call it. A lot of you, I know. Just think if you could have a part of your brain that's important for memory improve just simply by doing breathing exercises. This is another interesting study that I like. This was done at Wake Forest University. And what they did is that they wanted to look at the effects of mindfulness and breathing exercises on pain. And so what they did is they took 15 people who didn't ever do any meditation whatsoever, and then they gave them 4 days of mindfulness training. Just 20 minutes, 4 days, and they taught them how to do mindfulness, breathing exercises, focused attention, being in the present moment, and just ask them to practice this for 5-10 minutes every day. Then after a while, what they did is that they took them into the laboratory and then they gave them a painful stimulus. It was an electrical stimulus, not real painful, but it's something that causes discomfort. And you look at this is an MRI of the brain again, and look at the left side. This is what happens on the MRI in people. They compared it to people who don't do meditation or mindfulness. And this is what normally happens when they felt the pain, is that these parts of the brain would light up. But look at the people who were practicing mindfulness each day. This is what their brains looked like. They were able to deal with it a lot better. What it showed is that those people who practiced mindfulness had decreased pain perception by 57%, and they also had a 40% reduction in intensity of pain. So they actually showed that practicing mindfulness can decrease pain. Just think of all the pain medicines some of you have been on and how many of them you failed. Just think about this, something that's free of charge, doesn't cost you a thing, just 5 minutes a day, and can give you some pain relief. It's such an important thing for you to learn to do. There's been so many other studies, by the way, and this is a nice little poster that shows the results of a lot of them. But people who practice mindfulness in research studies, them have shown that they have increased focus, better brain function, improved mood, and better cognition. Cognition is memory. Again, a lot of lupus patients have trouble with memory, and it helps out with memory. Remember the hippocampus being larger than normal. However, it also reduces stress. And it does this by decreasing the amount of cortisol and the amount of adrenaline that our nervous system secretes. And cortisol and adrenaline are bad for us when it happens all the time. It's important for us to live and to run away from those bulls that are trying to gore us, but it's bad for us when it's going constantly and we're not able to calm it down. So one thing I want you to take away is just do it. I know that many of you might have thought this sounded new agey before I started to talk, but I hope you can see from the research that it does work. So just do it. And all I'm asking for is 5 minutes a day. There are several ways you can learn how to do this, by the way. You can download apps. One of my favorite one is called the Breath Ball. This is actually a medical, one that was developed for medical conditions. It has special breathing exercises for improving sleeping. And I know a lot of you out there have problems with sleeping and insomnia. Some that are specific for anxiety, some that are specific for stress, and even some that are for people with lung diseases like COPD, asthma, and other lung diseases. There's a lot of other apps out there, by the way, like Relax Light and Headspace.
I'm reminding you.
Oh, wait a second.
Dawn, it is time to do your breathing exercises.
Oh, that's Alexa. I love my Alexa. She's reminding me to do my breathing exercises. Well, I'll wait till, Alexa, I'll wait till after the end of my talk. All right.
Sorry, I don't know that.
But anyways, you can go ahead and set it on your smartphone or, your alarm clock or Alexa, if you have Alexa like I do, to tell you when to do your breathing exercises. But also go to YouTube. This is actually one of my favorites. I do use YouTube, especially one called, if you do a search for mindful breathing meditation, you can put in the number of minutes you want to do. And we'll actually do this at the end of my talk. We're going to do a 3-minute mindful breathing meditation. And this is the one that I do every day. I do the 5-minute to 10-minute one. And I'll show you how easy it is. There's also another one called Breathing Ball on YouTube as well, but there's a lot of them. Next, I'd like to show you several other tools to help you deal with stress, very good habits to get into. And by the way, I'd like to thank Dr. Nita Gould. Her first name is Nita, N-E-D-A, last name Gould, G-O-U-L-D. She also works with the Lupus Foundation. She's a friend of mine up at Johns Hopkins. She's a psychiatrist who specializes in mindfulness and autoimmune diseases like lupus. And she gives out 3 helpful hints on things that you can do that are simple that can help you deal with stress. And first, let's say you made this pumpkin pie right here to give to me, Dr. Thomas. And by the way, to my patients, I love pumpkin pie and I love sweet potato pie, just a little hint. But let's say you made this pumpkin pie right here and your 6-year-old took a spoon and just dug out a little bit of it. Now, if you're a perfectionist, and many lupus patients are perfectionists, I know this for a fact, they'll look at the burned part of the crust and they'll see where their 6-year-old did that, and they're going to get upset. How can they give this to Dr. Thomas? This pie is just ruined. Well, I guarantee you, if you gave me this pie, I would love it because I guarantee it's probably going to taste amazing. But the perfectionists, they're going to look at this and they're just going to have it go through their mind over and over again about what a horrible mistake they did and how horrible this pie is to give to Dr. Thomas. Number 1, accept imperfections. We're not perfect. None of us are perfect. I'm certainly not perfect. I make mistakes all the time. Even when I'm with my peers, my lupus expert peers, we might talk about studies and such, but I always feel a little bit inferior sometimes or imperfect compared to them. And I know that they probably feel the same, but it's important that we learn that, none of us are perfect. And when you do that, you can learn to decrease stress. Then how about that traffic jam? Or let's say that you're in the grocery store and you see that line that only has one person to it. And so you get into it, you're going to get through right away. And then this man takes out his wallet. He has 50 coupons he takes out. And then she tells him how much it costs. And he has to get out every single penny to do the exact right amount. And you're thinking, oh my God, why did I get into this line? And then that can just make you go crazy. How many of you have been in that situation? In a traffic jam or in the grocery store line? It can make you anxious and it can make you feel bad inside. And that's a bad thing. It's important that we learn how to deal with even that simple kind of stress like that. And what Dr. Cole recommends is to don't lose sight of what really counts. And when you're faced with a stressful event like this, which happens to us all the time, take a few deep breaths. Do that immediately. Just learn how to do that anytime you have a stressful event. And by the way, practicing breathing exercises every day will help you learn how to take those few deep breaths when you're having a stressful incident like that. And then always tell yourself, this is not under my control. It's just simply a traffic jam. I can't do anything about it. And then also think about the things that you're grateful for in life. Think about the pets that you love or the family members that you love. But taking those few deep breaths, remind yourself it's not all that important in the scheme of things. And you can learn how to deal with those stressful events that happen to us all the time. All of us have this person in our life, that toxic person who's very judgmental. Any of you have anybody like that in your life, a family member, or we all do, believe me, I do in my family even. And sometimes things will happen and then you'll just get very stressed out about it. It's so easy to do, and you can have 2-3 days in a row where it just races through your mind about what they said and what you said back to them, and you had an argument or such. It's important to learn how to deal with these types of situations correctly as well. And what Dr. Gould recommends is that always remind yourself that you can't change how other people act. They're always just going to be that way. But you can change how you respond to their actions. The important thing to remember is that getting stressed about it, arguing with them, feeling bad about it, that's just going to hurt you mentally and health-wise. And so you want to remind yourself that you want to learn how to respond better to it. And so again, taking those few deep breaths and respond with kindness. Respond with kindness, and that can have really miraculous effects on your body and your brain. And just try this the next time. The next time that person or anyone says something mean or judgmental or whatever, instead of having that impulse to say why you were doing something or why they should say something different or do something different, instead, think of something kind to say, like, you know what, I'll have to think about that. That might be a good way to think about it. Or, I can understand where you're coming from, and let's do this or let's do that. But do something nice or say to the person, I'll be happy to help you out if you can tell me, what I can do. And then evaluate how you feel after you do that. And then the next time it happens, do your old self where you say something back, where you try to argue against them or do something, and then your mind races for a few days again, and you'll see a huge difference in what it does to your body and your brain. Bottom line is, if you can learn how to respond with kindness to people, it can make a huge difference. And one thing my office manager tells me, by the way, is we have a lot of sick patients. We have thousands of patients in our office, and of course we do have the difficult patients who are very tough on our staff and they're sometimes not very nice. And what our office manager reminds everyone about is that that person who is acting that way is probably suffering. And that's probably why they're acting that way. So just remind yourself of that. Take in a few deep breaths, respond with something kind, say that you'll help them out, and it can make a huge difference, and it absolutely does. So the next thing I'd like to mention is exercise. I was exercising when you first saw me on here, and again, I saw that, what's her name? Joyce Phillips, she was exercising, so thank you, Joyce, for doing that. But what they did is they looked at 111 men. This was the University of Chicago back in 2014, and it was the University of, the Department of Psychiatry. And what they did is they looked at some of the men and women in this study were regular exercisers, and some of them were sedentary. They were just not exercisers whatsoever. And then they gave them a stress test, a specific stress test that you can actually measure in a research setting called the Trier stress test. And what they showed is that the non-exercisers, when they had the stressful events, they had worse mood after those stressful events. And they didn't respond to the stressful events nearly as well as the exercisers. And what this showed is that exercise actually protects against the negative emotional consequences of stress. Just simply by exercising, you can actually improve the way that you respond to stress. So just another way that you can do regularly to help out with stress. And everyone, every single one of you should be doing 150 minutes of moderate aerobic exercise every single week. That's the recommendation of the Centers for Disease Control and the World Health Organization. It has so many positive benefits. It's the cheapest medicine I can prescribe for you, by the way. And I have a very busy life. I work over 60 hours a week, but I get in my exercise. It's such an important thing. And by the way, what I tell myself when I find myself being lazy, I say, I love to watch reality TV, for example. If I'm on the couch being lazy, I say, Don, exercise is as important to living as eating and sleeping. Exercise is as important to living as eating and sleeping. And so you just have to do it. So what we talked about during the last 40 minutes or so is that, number one, stress and anxiety are normal. It's a normal fact of life. It helps us to be alive, actually. But it becomes abnormal when it takes over our life, or we get stressed, we get very anxious during incidences that are not very stressful, or we don't respond to stress in the right way. But the good news is that everyone can learn how to decrease stress in their life.
Here's your reminder.
Oh, there's Alexa again.
It is time to do the treadmill.
Okay, I gotta do the treadmill. When I get done with the talk, I'll do the treadmill. Okay, so the next thing I like to do.
Here's your reminder. It is time to do the treadmill.
Okay, I'll do the treadmill later. We're going to do some mindfulness, and this is just going to be real quick. This is just going to be just a 3-minute one, and this is going to help show people how you can do mindfulness yourself. I like everybody to sit in their chair and just relax, just kind of just to find a posture that's relaxing for you. Try to think about your muscles relaxing. If you feel comfortable, close your eyes as well. That helps out a lot. While you're doing this, by the way, if you've never done breathing exercises or mindfulness, you're going to find that your mind wants to wander. Like you might hear one of your family members say something, or your dog might bark, or you might think about that dinner you want to prepare for tomorrow and think about, oh, I need to get this ready. Whenever you have intrusions of thoughts like that, that's perfectly fine, by the way. Just identify it, name it, say, okay, that I heard that, but now I'm going to come back to myself, into the present moment, be non-judgmental, and get back to my breathing exercises. And that's a very important skill to learn and to know how to do, by the way. So let's do just 3 minutes of this particular one. This is called mindful breathing, and it's the 3-minute one. So everybody close your eyes and let's do some mindfulness.
Mindful breathing. Close your eyes and rest your hands on your knees. Bring your attention to the touch of your body on your seat. Feel the weight of your body on your chair or cushion. Make sure that your back is straight and that you're comfortable. Take a few deep breaths. While you're breathing deeply, relax your shoulders, your stomach muscles, the muscles in your face, your hands, and your legs. Let go of all the tightness in your body. Now bring your attention back to your breath. Notice what it feels like as it enters through your nose, goes down through your throat, filling your lungs, and back out through your nose. Notice your stomach and chest rise and fall each time you breathe in and each time you breathe out. And just allow your breathing to be natural and relaxed. Now bring your attention to the feeling of your breath in your nose. Feel your breath as it comes in and goes out. Just focus on this sensation, paying attention to each time you breathe in and each time you breathe out. As you inhale, maybe your breath feels cool. And as you exhale, maybe it feels a little warmer. When your mind wanders, or if you become distracted, just notice what's going on in your head, and then gently bring your attention back to your breath, going in and out. Focus on the feeling of your breath and allow thoughts and feelings to come and go in the background. Now gently bring your attention back to the touch of your body on your seat and open your eyes.
All right, well, thanks everybody for letting me have you do that. And by the way, if you felt impatient during that, that's a perfectly normal feeling when you first start to practice mindfulness, but the more you do it, the easier it becomes. Also during that mindfulness, I heard my dog barking in the back. I said, okay, that's my dog barking. I'll get back to my breathing, and that's how you deal with that. But I hope that everybody can learn how to do mindfulness and start to put it to practice, and just start to do mindfulness just 5 minutes per day. That's all we're asking for. That's all it really takes to do this. Also, Dr. Nita Gould, she recommended that we learn how to accept imperfection. None of us are perfect, and if you can learn how to accept the imperfections, it can make life and stress much easier. Just another example is people who love to keep their house perfectly neat, and then you have that family member who loves to keep their dirty clothes on the floor where they shouldn't. Learn how to accept that in your life and not try to force them to be perfect, by the way. Such an important habit to learn. And don't lose sight of what really counts in life. Take several deep breaths whenever you're faced with any type of stressful event, like that car jam or someone's poking in front of you on the Beltway here in Washington, D.C., or someone's being mean to you. And then always learn how to respond with kindness to people who are not treating you very well. And then please exercise regularly. This has so many positive health benefits for lupus patients. It's one of the most important things to learn to do. So a couple of important resources. First is please join the Lupus Foundation. If you're not a member, go to lupus.org. They have a lot of great things on there. Zach was mentioning a lot of them. One of my favorites is something called the Expert Series. And one of them was done by Dr. Nita Gould. If you look at the bottom yellow highlight, you can see her name here, Dr. Nita Gould. But if you do go into Google and Google Nita Gould Expert Series, Lupus Foundation, you'll find this particular podcast that they did at the beginning of the COVID pandemic. And Dr. Gould gives some great advice on how to deal with stress, decrease stress. And she also does some mindfulness teaching in that as well. So it's a really, really good Expert Series podcast to look at. And then please consider going to my website as well. It's called the lupusencyclopedia.com. And at the very top, you'll see something called the Lupus Secrets, and just click on the Lupus Secrets. And when you go there, you'll go to the Lupus Secrets, which try to follow all of them, but you can download a stress reduction handout. There's a free handout about reducing stress that you can download yourself. Read it over, take a yellow highlight and highlight everything you're not doing so you can learn how to deal with stress. And by the way, Cindy, you must have been reading my Lupus Secrets because you were naming a lot of them during your talk. So thank you so much for doing that, because they're so important for all lupus patients to do. So during the past 40 minutes or so, I hope you can see that there's a lot of research that shows how stress absolutely does make lupus worse. But what's most important is that there's absolutely things that you can do to decrease stress and to learn how to lessen the abnormal or bad health effects of stress on your own life, and even decrease the effects of lupus. So learn how to do those. Tonight, do your first 5 minutes of breathing exercises. Starting tomorrow, try to get in 5 minutes every day. Start to exercise regularly, and please do the stress reduction habits. And if you learn to do these and actually put them into practice, I guarantee that you'll learn to conquer lupus and not let lupus conquer you. Thank you, and we'll be open for questions. And I want to make, I'll make Zach the host here. He taught me how to do that earlier. So, oh, right click. I right clicked, and
Well, I think I was able actually to just
good.
reclaim and just found a button that said that. So.
All right, great.
Well, thank you so much, Dr. Thomas. Yeah, no, just so many great things to take away. I really encourage everyone to visit lupusencyclopedia.com and check out the Lupus Secrets. Dr. Nita Gould, she's been on this series before. She's great. But yeah, thank you so much, Dr. Thomas. Really, really appreciate that. And again, we're going to send out those slides so that everybody has them for reference. So thank you. And yeah, if we could have everybody put their questions, we have a fair amount of people on the call here. So if you could just put them in the chat, I'm going to be monitoring the chat. Put your questions in there. We have, I would say, about maybe 10 minutes or so to get a couple questions answered. And while they're doing that, I just had a question too. I know, Dr. Thomas, you mentioned your presentation about getting out and exercising and it being as important as eating and sleeping. And a lot of things, or often I hear, I'm in pain or I'm suffering, or how can I expect to go out and exercise if I'm sort of constantly experiencing those types of symptoms? So I'm just wondering if you have any advice for people.
Yeah, Zach, and I certainly understand where this person is coming from. I hear that a lot from my patients. I've heard that from some of my patients who are here this evening. But I'd like to tell you just a short story, very short. A few years ago, unfortunately, my dad got very sick, and he was diagnosed with leukemia. He had to quickly go into the hospital, underwent a bone marrow transplantation, underwent chemotherapy. Dad was never an exerciser. He got very obese in his older age. And there he was laying on the bed, and he was bedbound in the hospital. Each day, the doctors had the physical therapist come by, and the physical therapist told him, Don, his name was Donald Thomas Sr., you have to exercise if you're ever going to get out of this bed. And so the physical therapist, what she would have him do is his exercise each day was just simply lifting his arms and his legs up and down, trying to get some strength back in them. And over time, he was able to lift them higher and get them stronger and stronger. And he said that he would do what she asked